Hello, everyone, and welcome to the webinar, Tell It Like It Is, Sexual Health and Wellness for Learners with Developmental Disabilities. So I'd like to start by acknowledging that the Canadian Public Health Association's office and where I'm speaking from today is located on the original unceded territory of the Algonquin Anishinaabe people, and they have been guardians of this land for millennia, and CPHA is grateful for the example their stewardship provides. So my name is Rachel McLean, and I use she, her pronouns, and I will be the moderator for today's session. I am a senior project officer at CPHA, where my work focuses on sexual health, healthy relationships, and stigma reduction. So I'm going to spend just a few minutes covering some very basic housekeeping items and then pass it over to our speakers. So hopefully you can all hear me through either a headset or the speakers on your computer. Just due to sort of the nature of this presentation, we have disabled everyone's microphone. However, we do want to hear from you. So please do share your thoughts or your comments, your questions throughout the presentation, either by using the chat or the question and answer function. So if you have general comments to share, you can use the chat function and just make sure that you are sharing your comments with all participants by making sure that all participants are the recipient by using that drop-down menu. If you are having any connectivity or audio issues, you can use the chat box to type a message directly to my colleague and co-host Laura, and she'll be monitoring for any issues and do her best to help you out. So there will be time left at the end of the presentation for questions. So you can write your questions to the presenters at any time over the next hour using the question and answer feature from the menu on the bottom of your screen. And just a note that those questions will be shared with other webinar participants. And then lastly, just a note that today's session will be recorded and made available on CPHA's YouTube channel sometime over the next few weeks. And you'll also be sent the slides and a link to the webinar recording in a follow-up email sometime over the next few weeks. So here's some information for anyone that might be having some audio issues. If you can't hear me right now, hopefully you can kind of get some help by reading what's on the screen. And as I mentioned, if at any point you have any audio issues or any connectivity issues, please contact my colleague Laura directly using the chat feature. So today's webinar is part of a webinar series that CPHA is hosting over the fall and winter of this year and into 2021. So a lot of our work at CPHA focuses on reducing stigma related to sexually transmitted and bloodborne infections, or STBBIs, as well as sexuality and substance use more broadly. But we know that we can't address STBBI-related stigma without also speaking to the ways in which STBBI stigma intersects with and is compounded by other forms of oppression, including homophobia, biphobia, transphobia, racism, sexism, ableism, and classism. So throughout CPHA's webinar series that we'll be hosting, presenters from across the country will lead us in exploring ways to better serve diverse communities with respect to sexual health, substance use, and STBBIs. So if you'd like to learn more about this webinar series, you can visit the project page that is shown on your screen. And you can also contact us at stbbi@cpha.ca if you're interested in presenting as part of this webinar series. And as I said, we will send these slides, so you'll have those links shortly. So with those housekeeping items out of the way, I'm going to hand it over to our three presenters. I'll just read a short bio for each of them and then over to them. So first, Natalya Mason is a registered social worker and sexual health educator. She is the education coordinator at Saskatoon Sexual Health. She completed a BA in psychology at the University of Saskatchewan and a BSW at the University of Regina. She is currently completing a Master of Arts in Women's, Gender, and Sexuality Studies at the University of Saskatchewan. She loves teaching and has been fortunate enough to work in classrooms throughout the province. She is dedicated to social justice and reproductive rights for women and girls. Next, Dallas Tedarenko is the advisor for social equity at Inclusion Saskatchewan. He has worked within the disability support sector for over 10 years. Dallas pursues a variety of artistic endeavors, including music, ceramics, painting, sculpting, furniture design, and drawing. And lastly, Kristyn White is the literary facilitator at Inclusion Regina. She has been involved within the disability sector for 10 years and completed her Bachelor of Kinesiology, majoring in therapeutic recreation at the University of Regina. Kristyn is currently completing a Master of Science at the University of Regina, and her research focus is on sexuality and disability. Kristyn is passionate about empowering individuals experiencing disability to make their own decisions regarding their bodies, lives, and experiences, as well as providing support for caregivers on this topic. So with that, over to you, Natalya.
Okay, now let's see. Get these screens going here. Perfect, okay. So my name is Natalya Mason. Hello to everyone. Today we're going to be telling you about Tell It Like It Is, which is a 10-week sexual health and wellness program for learners with developmental disabilities. This webinar is being presented by Creative Options Regina, Inclusion Saskatchewan, and Saskatoon Sexual Health. It's lots of people to present at the same time, but this has truly been a collaborative effort, the best group project that you could possibly imagine. So I'm really looking forward to sharing this program with you all today. So the objectives for today's webinar is to provide you, the learner, with the opportunity to explore the topic of sexuality and people with developmental disabilities, and to provide tangible resources so that you're better able to support family members, clients, or patients that you might be serving. By the end of the webinar, you should be able to address some of the barriers that people with developmental disabilities face, understand the impact of stigma and discrimination, and be able to identify some sex-positive strategies for providing sexual health education to people with developmental disabilities. So as we go through, really important to remember, of course, that you're going to get a copy of the slides. I know everyone always wants to know that. And we'll also be providing a ton of resources, so actual tangible things that you can take home from this webinar. I know that myself as an educator, that's kind of always what I'm looking for. And so we've got lots of time to talk about those things towards the end of the presentation. And I am going to let Kristyn introduce her organization.
Hi, everyone. Thank you so much for being here today. As Natalya said, we are really excited to talk to you about Tell It Like It Is. It's always fun when the three of us get together and share a little bit about this curriculum with you. So as mentioned, my name is Kristyn White. I use she, her pronouns. I work for an organization in Regina, Saskatchewan, located on Treaty 4, called Creative Options Regina, or CORE for short. So we are a nonprofit charitable organization, and we develop personalized support plans for people who experience disability. So we are rooted in the philosophy of gentle teaching. I highly recommend any of you interested in gentle teaching to check out our website. We have some great resources available to you on there. We strive to strengthen the fabric of companionship and community for all the people that we serve. And we have a really innovative approach to caregiving. So we're grounded in the recognition and celebration of the intrinsic value of each person. And we really strive to support people to live a life that they want to live instead of a life that maybe would have been traditionally determined for them. So that's a little bit about us.
Hello, everybody. Hopefully everyone can hear me well. As mentioned at the beginning of the presentation, my name is Dallas Tedorenko. I'm the advisor for social equity with Inclusion Saskatchewan. So we are actually located on Treaty 6 territory in homeland of Métis. And I want to acknowledge today that we're very grateful to live in kind on this land with the ancestors and of the First Nation of Métis, and reaffirm our relationship with one another. I'm really excited to be here today and talk a little bit more about Tell It Like It Is, but I will first start with giving a little bit of information about our organization. So we are the provincial advocacy organization for individuals who experience intellectual or cognitive disabilities in Saskatchewan. We have existed for, I believe this year is our 65th year. So we've been around for a long time. And very consistent with how Kristyn and CORE provision supports the individuals that they serve directly in the community, very much aligns with how we support individuals as well. So typically what we would refer to as person-centered supports. So the individual is always at the center of our advocacy efforts and helping them access or resolve barriers to meeting their daily needs in the community. And that's throughout, obviously, Saskatchewan. It's we support approximately 500 individuals just amongst the inclusion team. So that is a team of inclusion consultants or community advocates that support individuals from every area of the province. And as you can imagine, that becomes a significant challenge at times. And we also provide systemic advocacy support, employment support, and transitions to community life. My core responsibility is working on systemic initiatives and collaborating with wonderful partners in the community like Kristyn and Core and Natalya at Saskatoon Sexual Health to advance kind of those higher level initiatives that have kind of a broad base of impact.
And my name is Natalya Mason. I use she, her pronouns as well. I work for an organization called Saskatoon Sexual Health. We are also located on Treaty 6 territory and the homeland of the Métis Nation. Later, when I talk about some of the systemic barriers to sexual and reproductive health, we're going to talk about colonization and the fact that that has played a really big role in undermining or preventing people from being able to have access to information about their sexual health. So something that we keep close to heart and are thinking about constantly in our work. Our vision is a society where sexual and reproductive health and rights are celebrated and accessible to all. So we provide sexual and reproductive healthcare services in Saskatoon and the surrounding area with an emphasis on safe, empowering clinical care and education. And we work with diverse communities to promote healthy and informed sexualities. So when we talk about diverse communities, that really specifically speaks to people with developmental disabilities. As we go through this webinar, we're going to talk about the fact that they have traditionally been excluded from these kinds of conversations. And so it's really important to remember that sexuality is a human experience, and that means that all people have a right to have information about their sexuality and about their sexual health. And Tell It Like It Is was one way for us to address some of those barriers that we had noticed in the community. Okay, so Rachel, I'm ready for my first poll. I want to know more about the people who are in the room. So we're going to toss a poll up here, just asking kind of what different areas of practice you all work in. I do have 2 beverages, if anyone was wondering. I'm really committed to switching back and forth between the coffee and the water. All right, so majority of people coming from healthcare, that's perfect. This is going to be a really good fit for you, but social services and education and some DSOs as well, that's really awesome. If you responded other, you could also just let us know in the chat where you're coming from, kind of helps us get a better idea of what kind of resources you might be looking for. And my second question and second poll is, what are the most important messages that you believe young people need to receive about sexuality? And so that can include any young people, but even more specifically, if you wanted young people who are experiencing disability. Oh, we got some people in research, disability studies faculty member. That is fascinating. I love that. I want to hear more about it. Family Resource Center program, cool. I love these webinars. You get to just like talk to people from all different parts of the country working in so many different service areas and build those connections and networks, which I just think is so fun. All right, so skills to prevent STBBI transmission. Most people agreeing with that. Skills to maintain healthy relationships. I'm really happy to see that. As we go through, we're going to talk about the fact that lots of times when there are sexual health programs for people with developmental disabilities, they're often solely focused on abuse prevention and maybe not so much on skills that we need to develop or foster, maintain healthy relationships. So it's good to see a recognition there that those things are also important. The abuse prevention, of course, skills to determine personal values, and skills to navigate social media and technology. That's fantastic. And I also want to know, and this is my third poll, is what are your greatest challenges or fears when you are wanting to have these conversations with young people? So what are some of the things that maybe are stopping you from having these conversations? Or what do you think might be stopping other people, you know, either that you work with, support workers, that kind of thing? What stops us from getting into these conversations? I should have queued up some Jeopardy music for the polls while we were waiting. Missed opportunity. I do kind of feel like a game show host right now. The polls should just be posting up, or the polls should just be popping up on your screen. I'm not sure if there is a spot. It looks like there's a spot for it also maybe in the menu bar that you might be able to click on. I'm not 100% certain though. All right. So a lack of knowledge, a little bit of lack of comfort, saying the wrong thing. I'm really excited to see though that feeling awkward and fear of encouraging risky behaviors are kind of on the lower end of the spectrum. I think that awkwardness is something that we all experience when we're talking about sexuality, but it shouldn't be the thing that stops us from having these conversations. So we're going to talk about some of the strategies that we use to manage some of these challenges. Okay. So Saskatoon Sexual Health works from a sex positive perspective, which means that we acknowledge that all people are sexual beings in one aspect or another. Sometimes a kid will say to me, oh, well, what about somebody who is asexual? And absolutely, asexuality is a completely normal and valid identity, but it still exists somewhere on a spectrum of human sexual experiences. And because we live in a society that is very sexualized, it is likely that these are going to be conversations that people need to have regardless of whether or not they themselves are experiencing sexual desires. Also means that we know that sexuality is fluid. It's something that changes over the course of people's lifetimes. That sexuality is unique to the person experiencing it. So not every person is going to have the same experience of sexuality, and that's totally normal. This definition comes from the International Planned Parenthood Federation. It says, sex positivity is an attitude that celebrates sexuality as an enhancing part of life that brings happiness, energy, and celebration. Sex positive approaches strive to achieve ideal experiences rather than solely working to prevent negative experiences. And that's why I love this particular definition so much, because we're talking about trying to attain those ideal experiences, which everybody does have the right to. Not everyone knows this, but pleasure is a human right. And so it's really important that if we are recognizing each individual as a rights holder, that we are doing our best to make sure that those rights are protected and celebrated. At the same time, sex positive approaches acknowledge and tackle the various concerns and risks associated with sexuality without reinforcing fear, shame, or taboo of young people's sexuality or of gender inequality. So this work is particularly important to us in Saskatchewan because we face really poor outcomes when it comes to sexual health and reproductive health. We have really high rates of adolescent pregnancy. We actually have the highest rates of adolescent pregnancy out of all of the provinces. We have the highest rates of HIV and hepatitis C infection in the entire country. We also have really high rates of sexual violence. So we know that people are facing a lot of challenges when it comes to their sexual health, and access to this information or access to services for reproductive health might be impacted by things like poverty. So just not having the funds necessary to travel, to take time off of work, to buy birth control, that kind of thing. Geography. Saskatchewan is a massive province. I was doing some research in northern Saskatchewan, and not the part of northern Saskatchewan that you have to fly to, the part of northern Saskatchewan that you can drive to. And at one point I was in a community that was 9 hours away from Regina. Up until a certain period, Regina is the only place where people can access abortions in Saskatchewan. And so we need to think about what happens when it's a 9-hour drive for someone to move from one center to another in order to access services. Or even if you're in a rural community, like a farming community, and it's an hour to get to the next center where STI testing is available, how are you going to manage that as a 9th grade student who doesn't have a vehicle or whatever else? So geography has a really big part to play in terms of barriers that people experience. Education, high quality sex ed isn't something that's available to all students in Saskatchewan. Depending on where you live or who your teacher is, you might get really poor sexual health education, or you might get no sexual health education at all. Having access to information that is unbiased and medically accurate. So if you do live in a really small community and there's only one healthcare provider that comes there every 2 weeks, and that person doesn't share your same values, then you're not going to have access to the information or to the services that you need. Disability. People with disabilities are often excluded from conversations about sexuality. Kristyn's going to talk about that more, but we know that when it comes to sex ed lessons, sometimes they're just actually removed from the classroom and not allowed to attend or engage in those conversations. Inclusivity, so people who might identify as two-spirit, LGBTQ, aren't necessarily seeing themselves in a lot of these conversations. And we know that people who experience disability also have varying gender identities and sexual identities as well. So it's still a relevant conversation, even if we're talking about a specific population. And last, colonization. The last residential school to close in Canada was actually in Saskatchewan, the Gordon Residential School in 1996. And so we're still seeing impacts of residential schools today. We're still seeing the impacts of the 60s scoop today, of intergenerational trauma, of parenting cycles that have been interrupted. So all of those things are creating a climate where people in Saskatchewan are struggling to access their sexual health.
Okay, so as Natalya had mentioned before, people with disabilities really do have a long, extensive history of institutionalization, discrimination, marginalization, and as she mentioned, being left out of the conversation. And so there are many myths that lots of us have probably heard about people with intellectual disabilities, maybe even things that we've thought ourselves, because this is really the narrative that our society has when it comes to people with disabilities. So the first one is that they're asexual or they don't have any sexual desires. So I think this is probably one of the most common ones. I often hear people talk about how they don't think that people with disabilities are sexual beings or have sexual desires or interested in relationships or being sexual at all. So that's probably one of the biggest myths. The other one is that they're unable to consent to sexual activity. I think a lot of cognitive discrimination goes along with this. People thinking that just because someone does have a developmental disability or an intellectual disability, that they're not able to consent to sexual activity, so therefore they shouldn't be having it. And we know that this is also not true. The third one, another really, really common one that I think we still see and hear a lot today, unfortunately, is that they are perpetual children and that they need to be protected. A lot of people, especially a lot of adults with disabilities, do still get treated like they are children. We even hear it in the way that people talk to people with disabilities. You know, the high-pitched baby voice, the use of names like sweetie or honey is still very, very common in this field. And we do know that people with disabilities who are adults just like us, and they are not perpetual children. So I think that really needs to be reflected in the way that we care for people and serve people. The last one on this list is that they will be more sexually aggressive or promiscuous, or maybe more likely to commit sexual offenses if they are given the information about sex. So we know that this is not true. Sexual education can actually be preventative and can actually help educate people on a lot of these important topics. And you know, learning about this information or talking to someone with a disability about this information does not mean that they are all of a sudden going to go out and start having all this sex or start being sexually aggressive. It just simply means that we're providing them with the tools that they need to make informed decisions and make choices for them and what they want to do. The last thing I wanted to mention, I was telling Natalya about this earlier today. I'm not sure if any of you are familiar with the online platform called Open Future Learning. If not, I would highly suggest checking them out. They are an online resource. So they do have a website, which requires a paid for subscription, but they do have free content on their Facebook page as well as their Instagram account. And they are an agency that really offers a lot of great information and advocacy and very forward-thinking, relevant information on intellectual disability. And I recently watched a video that they posted. A prominent researcher, her name's Karen Harvey. She spoke in this video about women with disabilities and how really our society needs to offer an apology to women with disabilities for how they've been treated. And I think this really goes along with some of the myths that exist. Natalya is going to talk about this a little bit later, but, forced abortion, forced hysterectomy, completely having their reproductive rights taken away from them has been extremely common all throughout history for women with disabilities. And once again, there's a lot of cognitive discrimination that goes along with this, and us thinking that women with disabilities or people with disabilities are unfit parents or unfit mothers. And in this video, she talked about how some of the most loving, caring, incredible mothers are women who happen to have an intellectual or developmental disability. And I just thought that was a really beautiful sentiment, because we're often not told that. And we're often told the narrative that if someone with a disability is to get pregnant, that they need to abort it, or they need to give it up for adoption, or it has to be taken away from them because they're not able to care for that baby. And I think that is a really huge myth and something that we need to talk about a little bit more. So lastly, if anyone wants to put this in the chat, or maybe just something to think about a little bit, how do we help, what ways do we think these myths continue to be perpetuated, and how can we help to dispel the myths and stigmas to support people, to support the supports, but also people with disabilities? So something to think about, or maybe pop some ideas in the chat. We would absolutely love to hear some of your thoughts on that. So here's what we do know about people with developmental disabilities. So research has shown that they have the same sexual needs and desires regarding their sexuality as people without disabilities. And engaging in dating and sexuality at very similar or even higher rates than other individuals. I was just recently reading a study actually, and they found that the people with disabilities were more sexually active than people without disabilities. So the myth about them being asexual or not being interested in relationships is absolutely false. The third one on there is they often lack knowledge that can lead to increased sexual risk-taking behaviors. So not using contraception, negative sexual health outcomes, such as unplanned pregnancies, sexually transmitted infections. So oftentimes people just are not information. How can we expect someone to know how to make informed choices if we aren't providing them with that information? Us had learned any information up, or maybe we had to research it on our own, we also probably wouldn't have the knowledge. So it is very important that we're providing that to people. I see someone saying education is so important. Absolutely. So the last one is they may find social interactions challenging and may not know how to develop healthy relationships. So if we're not educating what a healthy relationship versus an unhealthy relationship looks like, it can be extremely challenging to know what that means. Even for people without disabilities, sometimes even knowing if you are in an unhealthy relationship or an abusive relationship can be very, very hard. So it's very important that providing that knowledge to the folks that we serve. So along with this, there's also a lot of barriers to access sexual education for people who experience disability. I know Natalya mentioned earlier, oftentimes people are actually physically pulled out of the sexual education classes in schools. I remember growing up, in elementary school, we had someone with a disability in our class, and he was actually taken out of our sex talks that we had with our teacher. And that was just kind of what we were taught was normal, and that's just what happens. So the first one is the reliance upon spoken and written material. So a lot of the traditional sexual health education that we see, it's lecture-based, it's textbook-based, and we've found that using a multi-model approach is actually a lot more beneficial when teaching people. So not everyone learns from a textbook. Not everyone who attends our classes is able to read. So it's really important that we, provide fun, interactive ways of learning, a wide variety of learning, whether that's videos, discussions, activities, hands-on stuff. It really does cater to a wider audience, whether someone has a disability or not. And then the limited peer and family support. So this is also extremely common. Many people still live in homes today where their supports, their caregivers, or even the organization does not support them in their sexuality, with their relationships. There are people not allowed to have their partners or their sometimes husbands or wives even enter into their room or to their home. Imagine being in a relationship and you're not allowed to have that person to your house. I'd be angry, and I think people have every right to be. So oftentimes we do see that people just do not have this support, whether it's from their family, their caregivers, their friends, and I think this really relates to a lot of the myths that are out there. And some of the ways that, we've been taught to think about people with disabilities. The second last one is a lack of professional training. So when I think of this one, I think a lot about caregivers. So, and for those who work in the caregiving field, I saw there was a few of you, I'm sure you can relate to this. There really is no formal training on how to support someone with a disability in their sexuality for caregivers, for families, for people who work in the field. It's, just not a topic that's talked about lots. And I think oftentimes caregivers do feel like they don't know how to have these conversations with people, or they do feel that they don't know their role, or they feel unprepared to talk to people about topics, or questions come up that even they don't know the answers to or make them feel comfortable. These are some experiences that I had as well when I previously worked as a caregiver myself. So if we're not providing training and we're not providing these resources to caregivers and families, or even healthcare professionals who also work with people with disabilities, that can be a major barrier when it comes to education. And then the last one is just negative societal perceptions about autonomy and citizenship. So we've kind of already talked about this, but just the idea that people with disabilities, don't have rights, but the truth is they do. They have the exact same rights as we do. And unfortunately, there's many people who don't believe that or don't agree with it. So it's really important we continue that conversation and ensure that, their rights aren't being taken away from them.
So we know that young people with disabilities, when we're talking about sexuality, that they do face unique challenges. This information, these statistics all come from a fact sheet that is called Women with Disabilities and Violence. And this is something that was made by Dawn. So you should be able to find that on their website. Women with disabilities experience sexual violence in various forms, such as violations of privacy, restraints, strip searches, and solitary confinement. Those things are seen in institutionalized settings, but sometimes also in group homes. And also forced abortion and forced sterilization. So Kristyn talked about that a little bit, but even myself and my own experience presenting on this information, presenting on Tell It Like It Is, have had caregivers approach me and say, how can I force my child to get an IUD? And it's really important that we remember that IUDs are a choice, and it's a personal choice. And so as much as we can, we need to be including people on those decisions when it comes to their sexual health. The assumption there is also that the worst possible thing that could happen, or the worst outcome, would be a pregnancy or someone with a disability having a child. And like Kristyn mentioned before, that's really problematic for a number of different reasons. In a study on women with disabilities, it was found that they are 4 times more likely to have experienced a sexual assault than a woman without a disability. So again, thinking back to abuse prevention, we know that that is important, but it's got to be woven into a lot of all of these other topics because there's many considerations here. And last, we know that women with disabilities who are Indigenous or from rural communities might lack access to information about available services in terms of prevention and response to sexual violence and abuse. And so talked about that right at the beginning of the presentation, but just remembering that those kinds of barriers, things like colonization, even just like living in a rural small community, are going to prevent people from accessing the care that they deserve to have. I could go on about this study for literally this entire hour, but I really just want to draw your attention to it. In 2018, the UN FPA put out a global study on ending gender-based violence and realizing sexual health and rights for young persons with disabilities. There's 2 versions of this report. So there is a summary brief, and I think it's probably about 60 pages. And then there's the full report, which is like 400 pages. I would definitely recommend checking out the summary brief just because it's a little bit shorter, but there's so much really fantastic information to support the ideas that we're talking about right now. If you were wanting to pursue kind of any of this on your own, it's a really good launching off place. Some of the key themes that came out of that is that young people with disabilities are often denied agency by stigma or discrimination, discriminatory laws, physical barriers, and inattention to their rights. Multiple forms of intersection or discrimination intersect and compound existing disadvantages. So again, thinking back to young women with a disability who are also Indigenous, lots of things going on there that are going to impede access. Disability is also a complex, dynamic, and evolving concept. And you'll probably recognize that right now because we've talked about cognitive disability, we've talked about intellectual disability, we've talked about developmental disabilities. And so there's lots of ways in which these ideas shift and change over time. So we need to remember that as well. These difficulties are going to be compounded by things like poverty, living in a conflict setting, living in the midst of a humanitarian crisis. If you even think about where we're at right now in terms of the pandemic and understanding that that's really impeding people's access to healthcare services as well. If you've got a disability, pre-existing health conditions, that kind of thing, and institutionalization. And the last piece there is just about data and being able to separate it out and look at different populations specifically to see how they are being impacted. And someone is saying, also, we rarely talk about sexualities in the plural. And yes, that is absolutely true. And there are a whole set of recommendations. I'm not going to read them all off, but I think that the first one is really fantastic, which is that young persons with disabilities and the representative organizations should be full participants in the design and implementation of programs affecting their lives. So basically adhering to that idea of nothing about us without us. And somebody asked what the title of this is. If you Google UNFPA, Young Persons with Disabilities, it'll be the first thing that comes up, but I will find the link if I can and pop it into the chat. Okay, now on to our website. Dallas is going to tell you about what we've come up with.
All right. I always love design and being able to create a centralized repository for resources and all the wonderful things that people done specifically for Tell It Like It Is. So take note, this is the website where you can find all things Tell It Like It Is. I'm also, like Natalya and Kristyn, a fan of cute names for things, and so we came upon nevertmi.ca, which we thought was very clever and a little bit tongue-in-cheek. And here's what the actual website looks like, which, as you can see, and as we go through the rest of the presentation, there is most certainly a lot of innuendo that is food related. So when you go to the website, there's so much information to go through. We're always updating it. It will be where you can find any resource related to Tell It Like It Is. We're currently just finishing up the design on a workbook for participants. You can go to the website and download the facilitator's guide and be added to the mailing list for updates and and then all our other resources. We're working on some videos right now. That'll all be up there too. So take a moment at some point and go through the website and see what you can find. So I'm going to talk a little bit more about the structure of Tell It Like It Is and some of the rationale or context that we've based some of the decisions that we've made on how to actually deliver the content to learners and how we best prepare facilitators to actually deliver that content. So as you can see here, and Natalya kind of identified this at the beginning of our presentation, everything is broken down into actually like 9 modules of content, and then actually the 10th module is like a final review. So as you look through the list here, we went through a lot of revisions. The content stayed relatively the same, but there was definitely some changes that we needed to make with regards to flow and how certain concepts built upon one another. So every module is really built upon the module that precedes it. And then there's obviously kind of core concepts that pervade every single module, like consent, personal rights, autonomy, things like that. That are incredibly important. And then the hope is by the end of the 10 weeks of programming that individuals and learners would have developed a core skill set to better navigate issues and ideas about their own personal sexuality and respecting the rights of individuals and others that they may be in contact with in the community or choose as a partner. I really appreciate some of the quick story. Some of the participants have been, they've had really wonderful insight, and it's always an opportunity to connect and kind of slow down. And because I'll get into this in the next slide here, how the actual sessions are structured. But it's just, I'm always, of all the sessions that I facilitated, I'm always amazed by the things that are shared and how quickly that group cohesion forms, especially when you're obviously well planned as a facilitator and you kind of have a through line that you've planned. It's a really interesting thing to just kind of create that safe environment of openness and kindness, and just sharing those lived experiences. So when we actually get into planning sessions for Tell It Like It Is, and when we provide facilitator training, we're pretty firm on the structure and approach. And obviously, depending upon the individuals that you would be supporting in the sessions, it would be a matter to the facilitators kind of designing or specifically looking at the needs of that participant group, and maybe making some alterations or thinking about approaching maybe some of the content a little bit differently. So obviously, same day, time, venue, and facilitators every week, which speaks to the matter of consistency. Which would be true for anybody else, right? You wouldn't want to show up at university and have a different professor every week, or maybe you would, depending on your professors. But that relationship building is really key. And this is kind of one of those pieces where Natalya and I, when we've facilitated sessions in Saskatoon and other areas of the province, we've almost maybe been at a little bit of a disadvantage compared to, Kristyn and CORE, because typically they're supporting a lot of individuals that they're already connected to. They have a lot of those relationships that have already been built. Whereas in other areas of the province and with other facilitators, sometimes all the individuals that are participating are new to the facilitators. They've never met them before. They've never had an opportunity to get to know them. As the sessions progress, they most certainly are able to do that relationship building. But it's just it's a slightly different approach that's taken depending upon which organizations or who's facilitating in the community. Each session is around 1.5 to 2 hours. We've had sessions that have been less. We've had sessions that have been a little bit more, and it also depends on how things are going. Facilitators are most certainly encouraged to, if they need to split a certain session or if they need to come back to a topic at a later date, it doesn't have to be 10 sessions, 10 modules on such a strict schedule. It is very much directed by the participants that are in each of those sessions. As Kristyn kind of mentioned before, a multimodal approach is absolutely necessary. So we use videos, demonstration, interactive activities, worksheets, conversation, storytelling. We've had groups that have engaged in some like acting and like role playing. It's just every tool is always welcome to really develop again that group cohesion and share that information. And it's it's quite amazing seeing everything kind of come together. And Kristyn kind of mentioned this before, that typically in the field, we see a lot of lecture-based learning or skill development with the individuals that we serve, or a lot of written materials and resources. And for a population that historically has very low literacy skills because they maybe have been in segregated programming throughout their primary and secondary schooling career, or they just have never actually had that education during any period of their life, it's putting up a barrier to them actually accessing that information when they need to. So that's why we approach the information dissemination through a variety of different resources, being concrete, concise, and repetitive. I saw one of the comments in the chat box earlier that one of those barriers, at least perceived by professionals, may be that you don't know something, or you're worried about giving the wrong information. And to that, we always say that nobody expects you to be an expert on everything, especially when it comes to sexual wellness, and because everybody's experience is unique to them. It is, and this is a piece that I've taken from Natalya, and I very much believe, it is okay to tell people that you don't have the answer, but that you will find it and get back to them. And that is true for anybody in any field, not just with regards to the people that we support. Even though you may be a facilitator of Tell It Like It Is, and sharing that information with participants, it is entirely okay to not know. And I mean, all of us learn for the rest of our lives, right? Creative time and opportunity for questions and discussion. That's incredibly important, to leave that space where people can share their lived experiences, can speak about how they've maybe used that information in their lives at some point, or their understanding of the information. What we've come to recognize with a lot of the participants in Tell It Like It is that they've been given very bad information at some point in their lives by someone that was potentially very well trusted, or perceived as an authority figure. It could be a caregiver, it could be an agency or organization, doctor. There's been a variety of scenarios. So trying to kind of unpack that, and obviously there can be a lot of trauma involved with that relationship over those years too. If all of a sudden you have Kristyn telling you that everything that you know about sexual wellness is maybe wrong or misguided, that can be a pretty heavy conversation to have dropped on you in the middle of a class. So creating that space. We also make time for participants to speak in private afterwards if it's most certainly a topic that maybe shouldn't be shared in the group at that moment, or it just requires a little bit more of engagement beyond kind of the parameters of what's being offered. Support the supports, that's a big one. And this is one that Kristyn talks about quite often too, coming from a direct support background. If your facilitators are not comfortable in the content, or they're not prepared to answer some of those maybe difficult questions, or to share some of their own lived experience, it really has a negative impact on the group. And you always want facilitators to feel supported and valued in what they're doing, because that confidence that carries through to supporting those participants. And again, it really plays into that group cohesion, which is absolutely critical. And then in big bold letters, repeat, making sure that we can't expect facilitators or participants to know everything the first time they hear it, or the second time, or the third time. And that's why again, the modules are built upon one another, that those kind of core themes and concepts are kind of woven throughout everything. And it's that through line, because eventually individuals will internalize those lessons and that information and be able to use it effectively in their lives and making good, positive choices.
Okay, I'm going to move you to the next slide here, but I'm cognizant that we've only got 10 minutes to go. So I want to make sure that there's time for questions. So we're going to keep going until I see some questions pop up in the Q&A box. And we would love to answer any questions that people have. So if you do have one, make sure you do that.
So the education we provide is sex positive, comprehensive, inclusive, person-centered, interactive, intersectional, and evidence measured. And as you probably gathered by now, we keep saying the same kind of key phrases and words over and over again, because it does form the philosophy of what Tell It Like It is and why we do what we do. So this fellow in the photo here is Cody. Gave us permission to use his photo and his name, and it's a bunch of sperms and eggs. Is that correct? Yeah. Okay.
Yeah.
He was, and this was during the wind up. So during that 10th session, we typically have like games related to sexual wellness, and like a pizza party and some snacks and stuff like that. And Cody was a pro. So he's pretty pumped to pose in front of the whiteboard at our office and with all the wonderful drawings on it. So kind of speaking about the philosophy of Tell It Like It Is and why we do what we do, we came up with a series of goals that were important to us to kind of identify our target outcomes and to be able to really, again, disseminate the efficacy of the program and why it's so needed. And obviously with goal 1, we will assist learners to develop effective communication skills and build a strong sense of self-esteem and to make decisions and build relationships. Again, I've been going on and on about relationships. It is absolutely key, even though it's a short period of time that you have with participants. It forms the foundation of all that long-term and permanent learning. Goal 2, we will provide learners information about importance of good personal hygiene. That's one that's come up over and over in our sessions that we maybe overlooked at one point, but then a lot of this kind of goes back to the lived experiences and the unique circumstances of a lot of the individuals that we support collectively, and they maybe haven't had an opportunity to learn, how to properly shave or clip their fingernails or comb their hair, things like that. And when we get into like the ideas of courtship and making lasting relationships, whether it be a friendship or with an intimate partner, things like that are important. So we got more and more questions about it. So it was definitely something that we needed to identify. Goal 3 will help learners understand and recognize healthy and unhealthy relationships. That's a core concept that kind of goes back to Natalya and Kristyn speaking earlier about, when you're in the middle of something or you've only ever experienced negative relationships, you don't really have a baseline to compare it to anything else, right? So it's really important to be able to kind of draw a comparison and a rationale of why something may be deemed a positive relationship or a negative relationship and how to better identify the both and remove yourself from potentially a dangerous and destructive situation. Goal 4, we will provide the opportunity to understand boundaries for touch and talk in different types of relationships. That's when it gets into like some of those more heavier conversations that maybe some facilitators don't feel like they're equipped to have. But again, through training with Tell It Like It Is, they developed like that comfort and especially building that rapport with participants in each of the sessions. Goal 5, we will ensure learners are receiving accurate and comprehensive sexual health education to be able to make informed, and that's Tell It Like It Is as a whole. We want individuals to be able to express agency over their bodies and their choices and decisions, even though they may be in environments like Natalya said, group homes where it's not necessarily promoted, or they're living in institutional facilities where decisions are made for individuals all the time. We want to make sure that they are empowered to make good, well-informed choices and decisions that benefit themselves, and again, really target those ideals of positive relationships rather than, like Natalya said earlier, preventing negative relationships.
Okay, so I see some questions in the question box. I want to make sure we have time for that. So what I'm going to do real quick here is take us to the resources that we've made so Kristyn can tell us about those quickly. Everyone's getting the slides, and so anything that we are passing over right now, you'll have access to that later, but Kristyn's going to offer to mail out some stuff to you, so we want to show you what it looks like.
Okay, I think this is probably something we're the most excited about. Some of these resources are new and they're awesome. So the first thing I'll show you guys are these. You can see Natalya has put a picture here of the donuts. So these are just kind of like our little business cards. They have like these amazing little graphics, which everyone absolutely loves. And on the back, it has our website. So usually I pass these out during the first session, just because a lot of people who come to the class, they want to look at the curriculum. They want to talk about this stuff with their caregivers or their support workers when they go home. And so providing people with the little card, it's easy for them to access. They know where the website is, and it has all our little partnering logos on it. So that's that. These are amazing. These are door knockers that we have developed for people to literally put on their door if they do not want to be disturbed. So this one has the little gummy bears. And then on the other side, it says, do not disturb. So like we mentioned, a big problem can be people who do live with roommates or people who do live in a group home situation. They don't necessarily have that privacy, and sometimes supports or caregivers do just barge into the room without knocking. So our hope is that if someone does have a door knocker that says do not disturb, it'll really help people respect those boundaries and let them know that now is not the time to enter. So we have this one, and then we have this banana one with the socks as well. And then our newest resource, we actually just got these last week. So these are little information cards that we had developed. We pulled some of the most important information from the curriculums, and we put them on these super small, easy to access cards. So basically what our hope is that, during the sessions when we're talking about the relevant material, we'll be able to hand these out to the participants. They can take them with them. For some people, they really do need, that refresher on what certain things are. So we have one on decision making. We have one on safe sexting. So how to engage in online texting with someone sexually in a safe way. We have your rights, online safety, coping with difficult feelings, unhealthy and healthy relationships. We have a great one on gender identities, LGBTQ+. So those are our newest resources, wallet-sized cards that we thought would be great for caregivers, parents, participants, anyone. So I feel like I kind of rushed through that, but if you'd like me to send you that or a physical copy of our curriculum, email me at that email and I will mail one out to you wherever you're located. So let us know.
All right.
All right, so I see a lot of questions. Thanks to Natalya, Dallas, and Kristyn. That was super informative, and I know I'm super jazzed to go check out the website. There are a lot of questions. I don't think we'll have time for all of them, but maybe I can just make sure that I pass them off to the presenters, and they can get in touch with all of the participants. But I'll read out two, and then pass it over to you. So one of them is, one challenge I've seen is people getting information about sexuality, but framed in traditional gender roles and heteronormative approaches. How have you approached that? Like providing a richer menu of options for participants that move beyond gender roles and identities and heteronormative practices. So that's question one. And I'll just maybe give you two questions to answer in the spirit of time. How do you feel about presenting on Zoom? How will you adjust the delivery, obviously in light of the pandemic, and will your sessions be as long?
Okay, so I think that, correct me if I'm wrong, Kristyn or Dallas, but that one of the modules actually does get into gender roles and talking about what some of the expectations around gender are and how those ideas are problematic, how they put us into challenging situations when we're thinking about gender and power dynamics even more specifically. And so that's something that's brought into the conversation really early on. And then it's drawn through the conversation as we go through the modules. Just like Dallas said, scaffolded learning. So even I'm thinking about the module that's on technology and talking about pornography, there are conversations there about the problematic things that we see in pornography, sexism, misogyny, violence against women, those kinds of things. And so I think that it was something that, we were really cognizant of at the beginning and tried really hard to make sure stayed as a conversation throughout. Also acknowledging that, not all the participants are going to be like heterosexual either. And so that just adds so many complex layers. And I wouldn't say that any of the modules are perfect in their explanation, but they're definitely willing to engage and to start the conversation.
Something I'll quickly add to that, just because this is something I've been really, really working hard on in the classes that I'm currently teaching, and something that I learned from Natalya is just the gender neutral pronouns and not even necessarily mentioning gender when we're talking about certain things. So for example, when we're talking about condoms, instead of saying a male condom, just saying an external condom, because we know that not everyone who identifies as a male has a penis who would use a condom. So that's something that I have personally been really working on while I'm providing my education, and kind of trying to help the other educators here at CORE work on as well. And I think that's been really successful, and just kind of changing the way that we speak about certain things, I think can be really beneficial as well.
And then in terms of the second question about presenting on Zoom, also, hi, Heather. So I think that in my lessons that I've been doing on Zoom, just remembering that it's really hard for people to take in information in this format. And so I expect that they would be shorter presentations, maybe breaking up one module that was 2 hours in a typical in-class setting into 2 separate presentations, just to give people more time to digest, but also relying more heavily on videos and activities and games and that kind of thing, just to keep the learners engaged. I don't think we mentioned it yet. On the website, there's the facilitator's manual, and that's available for free. Anybody can download it, but we're just in the final stages of putting together a participant workbook. And so I think that once that's available, it's just one more way of incorporating the information that people are learning to keep them engaged in that learning process.
I just, and one quick piece around the virtual facilitation, something we've definitely noticed is that technology is a barrier to many people that we serve. So for a lot of individuals that we're connected to throughout the province, they don't have internet access, they don't have a smartphone, they don't have a computer. They want to participate, they want to be engaged in Tell Like It Is, and to have the information shared with them and to participate fully. But it's definitely something that maybe a lot of us have overlooked before, and being creative about how to get technology into the hands of the individuals that need it, so they can participate in something like this. And, for some individuals, they don't even necessarily have like a landline or phone access, right? So it has posed a unique set of circumstances. It's very easy for all of us to just kind of say like, oh, pop on a Zoom call or video conference and we'll just get things done. But it's not necessarily so easy. So again, forming those partnerships and collaborating with other community members to kind of maybe problem solve some of those technology-based issues is something to kind of be aware of as well.
So I think we're all out of time. I know there's a few more questions, but I have copied them. And so we will make sure that the presenters address them, and then we'll send them out to you when we do share the slides and the webinar recording. Thanks again to our presenters. I think that was super informative. And I think, all the questions are certainly a testament to, how important this programming is and how important it is to share this information, this knowledge. So I know that a lot of resources were shared. We'll share some of those links in our follow-up email with you as well. Please do take a few minutes to complete the post-webinar evaluation that will be shared with the presenters and also with CPHA, just to help us improve future sessions. So with that, thanks everyone for taking the time out of your days to listen in and participate, and have a great day, everyone.